Hello, my name is Schaller Mahl. I'm a student with Spring Arbor University, and this is my PowerPoint assignment for critical thinking on a patient with type 2 diabetes, hypertension, and obesity. The patient presents as a 76-year-old female here for her biannual wellness visit. Patients with controlled type 2 diabetes are seen by a provider every 6 months, while those who are uncontrolled are seen by a provider every 3 months. During her visit, she is noted to have a high blood pressure with 152/86, with a noted high systolic, and a BMI of 35, which patients with type 2 diabetes generally present in the 95th or greater BMI percentile. During the visit, the patient history is reviewed. This includes childhood and adult illnesses, current and past diagnoses, as well as vaccinations and health maintenance. Patient history also includes their family history, which type 2 diabetes has a significant family history tie, along with her social history with tobacco, alcohol, caffeine, illicit drug use, and sexual practices. Patients with type 2 diabetes generally have a very sedentary and physically inactive lifestyle. Moving on in the visit then includes a review of systems. Has the patient had a change in weight, whether intentional or unintentional? Have they had any ER, urgent care, or hospitalizations since they were last seen? Does the patient have any concerns to share with you this visit or any changes they've observed in their body? When reviewing cardio symptoms, it's important to ask what their physical activity is and if they have the ability to go up and down steps. When asking about their skin, it's important to ask if they have any areas of delayed wound healing or any open areas. This also includes asking if they have any areas of thickened skin or calluses, as these are often sites where diabetic ulcers will develop. When reviewing the gastrointestinal system, it's usually a good idea to get a meal recall to see what type of foods your patient is eating, which she admits to having a diet high in carbs and fat with lots of cookies, desserts, and bread products. She does say that she's usually eating soft foods now as she knows that she's been choking. This includes choking on water, and she admits that she isn't checking her blood sugar as often because she feels she eats less at meal times. However, she does notice that she snacks throughout the day and she drinks a large amount of water. When asking about their water intake or fluid intake, it's important to ask what type of fluids this includes, as well as the volume. Then you want to ask about genitourinary symptoms, as well as any sexual symptoms. She does get up 2 to 3 times a night to urinate, but she attributes this to aging. Reviewing musculoskeletal and neuro. Important to ask if they have any areas of numbness, inability to speak, tingling, tremors, fainting. She does note that she gets pins and needles in her legs that can sometimes be painful on a daily basis. She does get cramps in her lower legs as well, and she attributes these changes to instability. The provider can then still engage in questions as they perform the physical exam. Physical exam generally starts head to toe with first looking at their general appearance and coordination and ability to talk and have a conversation. Looking at the skin, skin is warm, pink, and dry. It's important to do an oral exam as well as a diabetic foot exam with every single visit. During the diabetic foot exam, you want to use a microfilament to check for diabetic neuropathy, which the patient has loss of sensation in both of the bottom of her feet, putting her at risk for diabetic ulcers. She also has overgrown toenails, which puts her at risk for infection, prompting the need for a podiatrist to trim her toes. Acanthosis nigricans is a darkening, velvety appearance along the groin, under armpits, and back of the neck as a sign of insulin resistance, and this is noted on the back of her neck. Looking at her skin, you also want to check under her skin folds, generally of the groin, abdomen, and breast, as these areas are prone to yeast infections, especially in obese and type 2 diabetic patients. Looking at the head, ears, nose, and throat, pupils are equal and reactive to light. You also want to do a fundoscopic exam, which also can note diabetic changes as she has microaneurysms and hemorrhages are seen. Listening to her heart, she has a regular S1, S2 with no S3 or S4. S4 heart sounds can be heard sometimes with insulin resistance along with diastolic dysfunction. Looking at her abdomen and listening to it, her bowel sounds are active, but she does have mild liver enlargement. Non-alcoholic fatty liver disease is also noted with insulin resistance. Lung sounds are clear. She is alert to person, place, and time, but there's mild hesitancy noted with words with a sad affect. Patient does note to have been a widow within the last year, which she has difficulty coping, and she cries whenever she talks about her husband. Diabetic patients should have a depression screen administered annually, and her PHQ gives a depression score of 10, which is moderate depression. She then talks about how she's alone and her kids living out of state and limited social interactions. Going on to musculoskeletal, she does have range of motion of her neck, shoulders, elbows, and wrists, however limited range of motion of her fingers, as well as her knees and ankles. She does look for nearby objects to grab whenever she's walking, and she has known that the osteoarthritis pain does limit her activities. While she declines a genitourinary exam, it's important again to ask if there's been any discharge, burning, frequency, urgency, incontinence, or blood in her urine. Patients with type 2 diabetics will often spill over glucose and sometimes protein, which can give off a frothy appearance or create a sweet smell to it. The plan of care is led by her diagnoses, which are uncontrolled diabetes and moderate depression. Uncontrolled diabetes would be evidenced by a high random glucose greater than 200 to 300 in the office and increasing hemoglobin A1C in her symptoms. Currently, her diabetes is controlled with metformin and a sulfonylurea with an A1C less than 7.5. However, if it's greater than 7.5 to 9 after 3 months of interventions, a triple therapy agent may be needed. Her symptoms include polyphagia, polydipsia, nocturia. She has a palpable liver, which could be the presence of non-alcoholic fatty liver disease, and she also has acanthocyst nigricans. Her depression is evidenced through a PHQ-9 score of 10. This can lead to worsening hyperglycemic or hypoglycemic episodes with confusion and falls, as well as deterioration in her diabetes control. Deterioration in her diabetes puts her at risk for blindness, heart disease, kidney disease, an immune-compromised state, and poor wound healing. Although we want to focus on her depression and diabetes, first we'll start with some basic consults, which would include a podiatrist for nail trimming and diabetic foot care, as she's at risk right now for a wound due to ingrown toenails. There's a place called Lovely Foot Associates here in Johnstown that specializes in diabetic foot care, in addition to podiatry, diabetes education, and diabetic footwear. There's also a place called Vantage Therapy here in Johnstown that does physical therapy, balance therapy, and aquatic therapy. The aquatic therapy may be appealing to her considering that she has arthritis in her hands and knees, which prevents her from moving. A swallow evaluation is also recommended due to her choking on liquids and more solid foods, which there's speech therapy here in Johnstown as well. Due to her increase in diabetes symptoms and worsening disease progression, a referral to Conemaugh Diabetes Clinic is needed with intensive diabetes training, education, and monitoring. There is a 10-hour class for patients for diabetes self-care management taught by registered nurses, certified diabetes educators, and registered dietitians. The class is broken down with individual attention on deficits, which can go over how to monitor your blood sugar, correct techniques, food choices, as well as diabetes self-care. There's also monthly group support meetings, which don't have a limit on how many meetings can be attended. A provider referral is required for this clinic. A nutrition consult would also be used due to her change in food habits and preferences from choking, cooking for one person, as well as a diabetic diet. Individual appointments with a dietitian are available Tuesday through Thursday in downtown Johnstown at the Lee campus. They also can help her with the ability to focus on weight reduction in addition to a diabetes diet. Provider order is needed for this as well, and forms can be faxed to Megan Stifler. A key part of the provider plan is going to be cognitive behavioral therapy for depression and difficulty coping with the death of a spouse, in addition to managing her diabetes. Depression and diabetes can be a deadly combination. Untreated mental health issues can make diabetes worse, and problems with diabetes can make mental health issues worse. But fortunately, if one gets better, the other tends to get better too. Knowlton Diagnostics and Treatment Center here in Johnstown provides specialty geriatric services, including how to cope with a chronic illness and how to cope with the inability to do things you used to do and loneliness, which our patient is suffering with the death of her spouse, as well as a decline in her physical condition. They also have case management available for local support groups, including meal delivery. They also work with medication management and dementia screening, and they also do individual and family counseling. Patients may self-refer or they may have a physician referral. If patients cannot attend to the clinic in person, they can do telecommunication. Barriers to healthcare. The American Diabetes Association provides a list of specific mental health providers for diabetes patients. Going on this website, there are no mental health providers with diabetes specialty training in our area, with the nearest physician being in Baltimore, Maryland, which is approximately 133 miles away. There are also no palliative care consult teams in our area. However, there are hospice consults available. Palliative care consults include symptom management for chronic illnesses while patients still undergo aggressive medical treatment. A barrier to care is also going to be the climate in Johnstown, as we receive ice and snow from October through April. The patient admits to already limiting her driving to about 20 minutes or less, as well as difficulty moving with her hands and her knees. This creates road hazards and would prevent senior citizens from accessing community services. Short-term goals. The best medicine is that which is administered. In order for these interventions to work, the patient has to attend. Short-term goals will be within the next 3 months attending the Conemaugh Diabetes Institute and going through the class on self-care management. A big goal is also attending cognitive behavioral therapy to be able to get a handle on her depression. We also like her to begin monitoring her blood glucose levels at home at least 3 times a week, fasting and postprandial, which is 2 hours after meals. With her ingrown toenails, she also needs to see a podiatrist for foot care. She also admits that she had been forgetting her medications in the evenings due to changes in meals. We would like her to become compliant in her medication, as dosages may not need to be increased if her medication is taken as ordered. We also would like her to attend her physical therapy for balance and strength training to prevent falls and to help keep her independent in her home longer. If she finds that she's unable to attend physical therapy for balance, strength training, and aquatic therapy, we can arrange for a home health referral, which will bring the physical therapist to her house. A follow-up appointment would be made in 2 to 3 months to check on her A1C, fasting glucose, as well as her compliance with the interventions. Long-term goals. Ideally, we would like her A1C to be less than 7%. If her A1C is 7.5 to 9, we could start her on triple therapy, maintain on the dual therapy, or regress down to monotherapy based on her signs, symptoms, and her labs. We also would like her blood pressure to be less than 140/90, which may be attributed to anxiety. However, we do have room to go up on her medications to control her blood pressure. Blood pressure measurements can also be obtained on more than one visit and at home to ensure that her blood pressure is not just high from white coat syndrome. Regular visits with cognitive behavioral therapy with a PHQ score less than 5 is a long-term goal, preferably within 6 months, if not 3 months. We also would like regular physical activity, with moderate activity being 150 minutes of aerobic a week. Activity, regardless of weight loss, improves insulin sensitivity within the body, and that can help decrease her A1C levels. We also want her to be able to maintain safe, independent living in her private residence, which will be evidenced by adequate meal intake, blood glucose regulation, and no falls in the home. Reflection. I did not know that Lovely Foot Associates in Johnstown existed, which is podiatry that is exclusively focused on diabetic foot care with other specialties within the building. I didn't know that they did diabetes education as well as fitting with socks and shoes, and that is a service I will probably begin to utilize. I also didn't know that Vantage Physical Therapy had an Olympic-sized indoor pool and that they did aquatic therapy with their patients in addition to occupational, speech, and physical therapy. Although physical therapy can't be provided in the home, if patients are able to drive, I think the aquatic therapy would be more beneficial for the patients who complain that they can't exercise because it hurts too much. The Knowlton Diagnostics specializes in geriatric therapy, which includes loss of spouses, loss of family members, friends, loss of independence, the aging where you don't do things that you used to be able to do, loss of functionality. I did not realize that they also do nursing home consults and they also provide therapy to patients in the nursing homes. That is also probably a resource I will utilize a lot as a practitioner, as many patients tend to deteriorate after a nursing home placement. Thank you for listening to my presentation. There were lots of resources I found in Johnstown, and I feel like I could have spent probably half a day talking about them. Have a good day. Thanks.